Welcome to the Perrysburg Podcast, episode 118. I'm your host, Perrysburg resident Kim Newlove. The Perrysburg Podcast is a resource for Perrysburg residents. We talk about what's in Perrysburg and why people like to live here. Our website is perrysburgpodcast.com. We are talking about pharmacies today. This is the fourth and final episode in this year's medical series. Let me just recap the series for you real quick, then we'll dive right in. Part 1 was about Prime IV hydration and wellness in January 2025. You can hear my conversation with the owner, Shannon Kazel, and her lead nurse, Chelsea Hansberger, in episode 78. Part 2 was about how to be a patient in Perrysburg. That was episode 98 in June. Part 3 was about how to be a pet owner in Perrysburg. That was episode 114 in September. And then the fourth and final part is today, and it is about pharmacies. Why talk about pharmacies and why October? Well, first of all, I am an Ohio pharmacist, and October is American Pharmacists Month. And this actually happens to be National Pharmacy Week. I looked it up. According to the American Society of Health System Pharmacy, which is abbreviated ASHP, National Pharmacy Week is an annual observance that acknowledges the invaluable contributions that pharmacists and pharmacy technicians make to patient care in hospitals, ambulatory care clinics, and other healthcare settings. Thank you for all you do, pharmacists, pharmacy techs, and of course, students as well. You are future pharmacists. Now that you know about the series and the timing of this episode, let me tell you what we'll cover today. First, I'll share my experience as an Ohio pharmacist. Next, I'll list the pharmacies in and around Perrysburg. I'll sprinkle in an announcement about Drug Take Back Day and drug take back boxes as well. Then I'll talk about covering medication costs. And finally, I'll share my conversation with Dr. Erin Albert from Mark Cuban Cost Plus Drug Company. All right, let's get started with my experience as an Ohio pharmacist. Just in case you didn't know, I am an Ohio pharmacist. I am no longer in clinical practice. That actually means that I have a valid license, but I don't work in a pharmacy anymore. I'm needed at home to be a full-time caregiver for my adult son, Craig, who has autism. In my free time, though, I do work part-time with my business. My business is called The Pharmacist's Voice, LLC. I write, narrate, podcast, coach, and consult on a part-time basis. To learn more about my business and my happy clients, visit my LinkedIn profile. I've got a link to it in the show notes on perrysburgpodcast.com. Now, as far as my formal training, where did I go to school? I went to the University of Toledo College of Pharmacy, and I graduated with my BS Pharm in 2001. As a student, though, I worked at Rite Aid right here in Perrysburg with Jeff Musinski and Peggy Long in 1997. That was my first pharmacy job ever. And then I did a 3-year internship at Toledo Hospital. I worked in the IV room, the inpatient pharmacy, the outpatient pharmacy, and on rare occasion, I shadowed the surgery pharmacist. And like I said, I graduated with my BS Pharm in 2001. Now, just so you know, back in 2001, a PharmD degree was not required, so I didn't get one. But pharmacists who have a PharmD degree and a BS degree do the same thing. I have worked for a number of pharmacies over the last 24 years, including St. Luke's Hospital, Walgreens, a small compounding pharmacy in Sylvania that got bought out by a competitor long, long ago, and I also worked for Arrowhead Behavioral Health in Maumee. You could say that I have experience in hospital, retail, compounding, and behavioral health. And then in 2017, I started my business where I now write, narrate, podcast, coach, and consult. And the Perrysburg podcast is not part of the business, it's just a service project or a hobby podcast. I have a lot of pharmacy-related volunteer work, and I'll just name a few of my volunteer positions. I have done poisoning prevention education with Safe Kids Greater Toledo. That means I go to health fairs and I talk to people about poisoning prevention. I give them the poison helpline number and we talk about pretty poisons. I've also done poison prevention education in the elementary schools, actually just at Fort Meigs Elementary, and I've also done career day speeches at Perrysburg High School. I've also done some drug abuse prevention and treatment advocacy with a number of agencies, including the Wood County Addiction Task Force and the Wood County Prevention Coalition, and both of those are out of Bowling Green, Ohio. And the last thing that I'll mention is that I do some volunteer work with the Ohio Pharmacists Association. That's our state pharmacist association. I'm on the communications committee. I put my experience as an Ohio pharmacist at the top of the episode, not to impress you, but to impress upon you that I am an Ohio pharmacist and that pharmacists can work in a lot of different settings. All right, let's move on to my list of pharmacies in and around Perrysburg. By my count, there are 10 public facing pharmacies where you can get prescriptions filled. There are 5 on the east side and 5 on the west side. Let's go with the east side first. Number 1, there is a CVS pharmacy inside Target on Route 20. Now, that's technically a Rossford address, but I consider it a pharmacy in Perrysburg. Number 2 is Meyer Pharmacy on Route 20. Also, that is technically Rossford, but I consider it a pharmacy in Perrysburg as well. Please note that there is a drug take back box at this Meyer store on Route 20. Any day they're open, you can drop off your unwanted medications at Meyer. Please note that the receptacle has directions, so they do only accept solid pill doses. You cannot put your EpiPens, your inhalers, your creams, your liquids in their box. Number 3 on my list is the Walmart Supercenter Pharmacy on Route 20. Now, technically, this is Perrysburg, even though it's right next to Meyer, which has a Rossford address. Zoning in Perrysburg is fun, isn't it? Number 4 is the Walgreens on Route 20 at Thompson Road. And number 5, there is a Kroger Pharmacy on Carronade Drive here in Perrysburg. And that does it for the east side. Now for the west side. All 5 of these pharmacies are located near the corner of State Route 25 and Eckel Junction Road. If you know State Route 25 by its other name, it is North Dixie Highway. So we're talking about the intersection of North Dixie Highway and Eckel Junction Road. The 5 pharmacies that are located here are number 1, Booterer Drug Company, Inc., and that's got a North Dixie Highway address here in Perrysburg. This is an excellent compounding pharmacy, and we are very fortunate to have them right here in Perrysburg. Number 2 is Walt Churchill's Market Pharmacy. That has a North Dixie Highway address as well, and it's literally just a few doors down from Booterer Drug Company. And by the way, the pharmacy department inside Walt Churchill's Market has just moved to a different spot inside the store to make room for the new liquor store. The pharmacy is now located near the produce area. Congratulations on the updated spaces, Churchill's. I think everything looks great. I love how it's set up. Number 3 is the Drug Store of Perrysburg on Craig Drive. That is across the street from Churchill's near Black Diamond Lawn Care Center. Number 4 is Costco Pharmacy on North Dixie Highway, and Mercy Health Perrysburg Hospital's outpatient pharmacy is the 5th and final pharmacy on the west side on my list. It has an Eckel Junction Road address, but it is located inside the main hospital building. The outpatient pharmacy there at Mercy Health Perrysburg Hospital also has a drug take-back box. You can drop off your expired and unwanted medications there. They accept solid tablets and capsules only. They do not take injectables, oral liquids, EpiPens, etc. And speaking of drug take-back boxes, this is a great time for me to talk about drug take-back boxes and drug take-back day. Perrysburg Township and the City of Perrysburg Police both have drug take-back boxes for your expired and unwanted medications. There are directions at both stations, both police stations, explaining what they will and will not take. If you would like to get rid of anything that is not accepted at Meyer, the outpatient pharmacy at the hospital, or both of the police stations, head over to Maumee Police Division on Saturday, October 25th, 2025, between 10 a.m. and 2 p.m. They are having a drug take-back day this weekend. You can literally drive through and drop your stuff off at their evidence bay behind the station. They usually have some signage so you can find it. It's near the corner of Conant and Dudley. So again, you can literally drive through, drop off your expired meds, and it can be the liquids, the creams, the ointments, the EpiPens, all that stuff. I usually do this twice a year for my own home, October and April. So whenever Mommy Police Division has their drug take back day event, I stop by and they do a great job. They have enthusiastic pharmacy students from the University of Toledo helping out, and it's just a good day to clean house. All right, sidebar over. That's it for my list of 10 community pharmacies in Perrysburg and my plug for Drug Take Back Day and the Drug Take Back boxes at Meyer, Mercy Perrysburg Hospital, Perrysburg Township Police, and the City of Perrysburg Police Division. At this time, I'd like to give a shout out to all of the pharmacies in and around Perrysburg that the average citizen just might not know about. Number one is CVS OmniCare on Ponderosa Road in Perrysburg, Ohio. They provide medications for long term care facilities like senior living facilities, hospice, and more. My brother Andy is actually a pharmacist there, and shout out to Andy. Thanks for all you do. Number two is Genoa Healthcare on Commerce Drive in Perrysburg. They are an in house pharmacy for harbor consumers. Number three is Mercy Health Perrysburg Hospital's inpatient pharmacy. Have you ever wondered how the patients in the beds who are admitted get their medicine? It's the inpatient pharmacy that handles their medications. So, shout out to all of the pharmacists and technicians at Mercy Health Perrysburg Hospital Inpatient Pharmacy. And then I'm guessing that there are mail order facilities around the country who help our Perrysburg residents. Thanks for all you do. And we have a VA in South Toledo that fills prescriptions for veterans. Thanks for all you do. And there are specialty and infusion pharmacies in our region who provide IV medications and specialty medications for our residents. One example that I want to highlight is the ProMedica Cancer Center at Levis Commons. I'm sure that there is an oncology pharmacist in our region preparing chemotherapy drugs for that cancer center. Thank you to all of the pharmacists, techs, and students who help our Perrysburg residents. I know there are a lot of pharmacists, techs, and students in and around Perrysburg. Again, thanks for all you do. That does it for my list of pharmacies in and around Perrysburg. Next up, I'll talk about covering medication costs. I know that some people are uninsured, underinsured, or maybe in a holding pattern because of a prior authorization situation or some sort of a step therapy. So this part might help you. Many people have a little plastic prescription card that their employer provided or a prescription benefit that they chose, right? Little plastic cards are synonymous with pharmacy benefits. Other people have TRICARE because they're active duty military, a retiree, or a family member. Still, other people have Medicare Part D, Medicare Advantage plans, or Medicaid. There are many ways to cover prescription costs. Unfortunately, there are people who are uninsured or underinsured. They pay out of pocket for some or all of their medications. Now, even some people with commercial plans may pay out of pocket from time to time for something that is considered not medically necessary. The drug's not covered, and there is nothing a doctor can do or say to make the insurance pay for it. So, regardless of the circumstances, consider these four alternatives to paying full price. Number one, prescription assistance programs. This includes copay cards and websites like rxassist.org or needymeds.org. Number two on my list is prescription savings cards like GoodRx, SingleCare, and WellRx. Number three is costplusdrugs.com. That is a mail order prescription solution. And the fourth and final one on my list is the Team Cuban card. You'll hear about costplusdrugs.com and the Team Cuban card from my guest, Dr. Erin Albert, in just a minute. As you can tell, there are many ways to pay for prescription costs here in Perrysburg or wherever you listen to this podcast. This is not a complete list, but it will give you some ideas on a few other ways to cover prescription costs. Be advised, though, that not all pharmacies accept all of these alternatives. With that said, that does it for covering medication costs. The final part of this episode is my conversation with Dr. Erin Albert from Mark Cuban Cost Plus Drug Company. Erin does a fantastic job introducing herself at the top of the interview. She'll tell you about herself, Cost Plus Drugs, the Team Cuban card, and an out of the box idea for researching drug prices. Without further ado, here's my conversation with Dr. Erin Albert. Hi, Erin. Welcome to the Perrysburg podcast. How are you?
I'm great. Thanks for having me, Kim.
It's my pleasure. I would love it if you could introduce yourself to my audience.
My name is Erin Albert. I am a pharmacist with Mark Cuban Cost Plus Drug Company, and we've been around now for about 4 years publicly. My title there is Chief of Pharmacy Relations, Network, and Privacy. I work remotely for them, but they're headquartered in Dallas, Texas. And a lot of what I do every day is as a pharmacist. And I started my career at retail pharmacy. So I'm coming at this interview today from that point of view.
Thanks for the introduction and thanks for everything you do. I'm excited to get into it here. If somebody gets out of the doctor's office and has their prescription, you can pay cash, you can use your commercial plan. If you have Medicaid, you can use that. But what can Mark Cuban Cost Plus Drug Company or the Team Cuban card do for a Perrysburg resident?
There's really two routes for patients to work directly with us. The first route, as you mentioned, Kim, is costplusdrugs.com. And costplusdrugs.com was kind of our first publicly facing foray from Mr. Cuban himself. He partnered with our CEO, Dr. Alex Oshmiansky, who's a practicing radiologist, but also noticed that a lot of his patients were really suffering because they could not get access, particularly to high cost, quote unquote, specialty drugs. And so they teamed up to co-found Mark Cuban Cost Plus Drug Company. And our first offering to the public was costplusdrugs.com. Costplusdrugs.com is a mail order solution for patients, and we team up with a pharmacy fulfillment partner who right now is Healthdyne. And you can submit your prescriptions electronically through your doctor's office to our mail order solution. And we have thousands of drugs available at costplusdrugs.com. It's very easy and transparent to use because we list our actual acquisition cost of those drugs on our website. We have a small markup, and then we have a $5 dispensing fee that goes to the pharmacy and a $5 mail order service fee to have it mailed to your house. And millions of patients now have benefited from that transparent option when there are few options out there. The second option that we have available for patients and our members is what we call the Team Cuban card. And that's available at teamcubancard.com because we noticed a lot of people really love their local pharmacist, right? They want to know, like, and trust their local pharmacist. They want to continue working with them. Furthermore, Mr. Cuban himself has a passion for particularly making sure that independent pharmacies thrive and stay alive. And what's been happening in the marketplace is a lot of pharmacies have closed their doors. Perrysburg is very lucky in the sense that it sounds like you all have a lot of pharmacy choices, which is great. But around the country, a lot of pharmacies have closed their doors because pharmacy benefit managers have put them out of business because they don't pay the amount of cost of the drug that the pharmacy actually pays to fill those prescriptions. So Team Cuban Card is our solution there. You can go to teamcubancard.com, look at our list. Again, we list all of our costs and everything is fully transparent there. We have our cost plus a 15% markup plus a $12 baseline dispensing fee that goes to the pharmacy and $1 extra for claims processing. And that's it. It's very transparent. We've got over 2,000 drugs on our list, and you can check prices and the pharmacies that are in our network all at teamcubancard.com. Download your own personal Team Cuban card for free, and then that card stays with you for life. It's not a one and done throwaway coupon. So those are our two options on working with the public.
Thank you for explaining those. It sounds like more for the chronic medications, you'd use that mail order, that Mark Cuban Cost Plus drug company option where you'd, send it electronically from the doctor's office to you guys. Or if you want to walk in same day, you would have the Team Cuban card if you would choose to go that route. Am I hearing that right?
Not necessarily, Kim. I mean, there are options for acute medications that you could get expedited shipping on at costplusdrugs.com. It really depends on what prescription drug is being prescribed to you and the options that we have based upon our drug list. We do have expedited shipping as an option as well. Generally, though, you are accurate in that most folks would want to get their acute medications near home with their local community network pharmacies. Whereas, most of those maintenance medications for example, hypertension or asthma or things like that that are less acute, you could get through costplusdrugs.com.
Thank you for clearing that up. I didn't realize there was expedited shipping.
Yeah, it's really nice. I think we've got some exciting partnerships and team ups coming up soon that are actually a little bit different than the scenario that you laid out. So I wanted to put that caveat on it.
Okay. I'm sure that I'm not the first person to go to the doctor and get a prescription by surprise and then try to figure out, well, what's the best way to pay for this? This is just another way to pay for a medication. So I think everybody should be considering this among all of their options.
I think one of the other big options is prior authorization, right? So if you go through your own plan, for example, sometimes they put what's called a prior authorization on it, meaning that you have to get permission from the company for them to cover it, from your pharmacy benefit manager in this case. A lot of folks have just completely circumvented that by using our card instead of going through the painful process of prior authorization, too. So it's another option for that.
Yeah, that's a really good point. I think a lot of people average people that are not in medicine, just don't know what their options are. And by us talking about that today, it kind of pulls back the curtain so people can see what their options are.
Absolutely. It's great to have options.
How about this next scenario here? Maybe somebody's got a hospital stay, they've had open heart surgery, or maybe a hip or knee replacement, and they get a whole bunch of prescriptions. Things have changed. It's not what they went into the hospital with. Now they've got a whole new medication list. How can your company help them with their medication costs?
Again, I think it goes back to the drug mix and what our drug lists offer to a patient. I would say on a discharge, it might be better to have that patient work with their local community pharmacy, right? Because they probably had a list of medications before they went into the hospital and went or upon discharge have a different list of medications. So my suggestion there would be for them to look up by zip code on Team Cuban Card, which pharmacies are in their backyard that are also in our network. Find a local community pharmacist that they know, like, and trust, and work with them on a local basis until they're stabilized and until their medications are more for that maintenance versus the acute situations.
Good answer. That really speaks to the value of working with the pharmacy that already knows you.
Absolutely, and that's the whole reason we started, Team Cuban Card and the Cost Plus Drugs affiliate pharmacy network. Is we all understand that there is value in your local community pharmacy being the closest threshold to accessing healthcare in this country. The challenge has been that a lot of communities have lost their local pharmacies. Again, to my prior point about pharmacy benefit managers not reimbursing them appropriately. So, we are here to support particularly independent pharmacies as well as chain pharmacies that we've networked with to offer those vital services closer to home and make sure that our network of pharmacies is fairly paid for their valuable services.
I like the cooperation. Erin, what happens when a Perrysburg resident would perhaps use more than one pharmacy? They've got mail order for some chronic medications, they're using a local pharmacy, and costplusdrugs.com. What do you think is the best way that they can keep everything straight and make sure everybody knows about one another?
Yeah, that's one of the big challenges, right? I will tell you that when you sign up on costplusdrugs.com, Kim, you are asked about your current medication list, and they do keep that on file. I think one of the big challenges right now is to make sure that you have a central hub for all of your medications. And I don't think any pharmacy out there really has a perfect solution for that. The PBMs like to argue that they're the ones in charge of overseeing the patient's total picture. But I do think that the patients, along with their primary care provider, need to take ownership of ensuring that all pharmacies are aware that the patient is taking a certain regimen of drug. And it is a challenge. I think we're going to get to a point someday in the future that the patient will have their own list of medications that'll be portable that they can take anywhere. We're just not there yet. So I think the best course of action there is to keep a up-to-date medication list and make sure any pharmacy that's filling any of your prescriptions has that list in hand.
Yes, that is such great advice. I always recommend to people keep a medication list, keep it updated and keep it with you, especially when you go to doctor's offices, doctor's appointments, and the pharmacy.
And if you live alone, there's another great tip. Keep a list of them in your refrigerator, because if you pass out and emergency medical technicians need to find you, the first place that they look is in your refrigerator for a list of your medications, the vial of life, they call it. So that might be a good strategy, as well as more and more single adults are out there now living alone. I think it's really important to keep that medication list somewhere accessible if you cannot advocate or speak for yourself.
I had not heard of that yet. That's a great tip. Thanks for sharing that.
Sure.
I've heard that people have smartphone lists too. They have that
Mhm.
health app on the iPhone, for example. And there's a way that first responders know how to get into people's phones and get that information. I think there's more than one way to do it. And thanks for sharing that one.
Sure.
When it comes to medications being affordable, everybody wants the best price possible, but they necessarily don't want to go through the trouble of comparing prices. It can be time consuming, and being on hold with a pharmacy while they check the price can be really frustrating. So, when it comes to people who are uninsured or they've got a high deductible, what's the easiest way to do all that homework? Checking multiple pharmacies for multiple drugs, including the cost plus drugs and the Team Cuban card.
That's a tough one, right? I would say I've been cheating a little bit. I use AI, believe it or not. I'll go ask ChatGPT or Google Gemini, hey, Google, hey, ChatGPT, who has the best price of XYZ at what strength and what quantity right now? Sometimes it gives a delayed answer. Sometimes you still have to go validate it. It's not always 100% accurate. But I actually think AI is a good starting point. You can go down the rabbit holes of other options that are available online. And last time I looked, there were probably 100 different options that you could use for cash pay online. So I actually think AI could be a helpful tool to at least get started to figure out what your best price is. As for your own insurance and your deductible, I hate to say it, Kim, but the best or probably fastest way to do that is just to go to the pharmacy and have them adjudicate the claim to see what the actual cost would be to the member. And if, it's not a palatable number, just have them hold the prescription or reverse the claim and then go do your homework.
Speaking of doing homework, one of the things I feel kind of frustrated with is there's this online portal for my husband's insurance. And if I go to it and I click on the pharmacy benefits section, I can type in the name of the drug and then finally get the price. It just seems like there's so many steps in that. Are there a lot of steps involved in finding out prices through costplusdrugs.com or the Team Cuban card?
Actually, the opposite. All you have to do is type in the drug and you get the name of the drug, you get the strength, you get the quantity, and you get the price. You see all of our math as well. You see the actual acquisition cost, any markups, any dispensing fees and any extra fees on the case of Team Cuban Card. We've got that one extra dollar for claims processing because we have to hire a claims processor. We don't do that in house. But we show all our math. And I double dog dare any of your folks out there listening to find any other pharmacy or site that is literally listing out how they got their formulas to come up with their total costs. Now, there's sites out there and pharmacies out there that will list their pricing, but they won't break down their math. And transparency is what we're all about at costplusdrugs.com and teamcubancard.com. You know exactly what you're going to pay before you roll into the pharmacy.
I appreciate that. Yes, it seems like as pharmacists, you and I both know that the transparency in drug pricing is a huge issue right now for the pharmacy profession. It's one of the things that pharmacists are not able to control. We can't control the information that someone else shows us. So trying to find the prices that are real and true across the board in every state and every town, it's really hard.
It is. I mean, there have been lawsuits over what is a cash price in certain pharmacies. It's insane. And there's so much opacity when it comes to actual drug pricing these days that I could see where most people get very frustrated with it, especially if there's extra complexities of like prior authorization or, you have to adhere to certain guidelines that aren't very explicit on your benefits card when you roll into the pharmacy and you get this sticker shock when you approach the counter and they tell you, your prescription's going to be hundreds of dollars and you weren't mentally prepared for that. So it's tough. It's a challenge.
Hmm. Erin, for any pharmacists who may be listening to this, Perrysburg area pharmacists, whether it's Perrysburg proper or one of those border towns around our border here in Perrysburg, what would you say to them about how Mark Cuban Cost Plus Drug Company or the Team Cuban card could help their patients?
Sure. So I did look up Perrysburg, Ohio to see which pharmacies are already in our network. And you all have Kroger and Meyer, which have been two very large chain partners and team ups for us. Even Kroger being one of the very first chains to say yes to our network. Beyond that, we are always excited to have more PICs or pharmacists in charge, as well as pharmacy owners, kick the tires on our program and learn more about it. All you have to do is fill out a very simple Google form, which I'd be happy to provide to your listeners, Kim, and we send you all the information. We do have a network contract. Our pricing is, I think, very fair and equitable to the pharmacies. Again, on the Team Cuban card, the formula is the actual acquisition cost of the drug, a 15% markup, a $12 baseline dispensing fee, and one extra dollar for claims processing. The other great tool that we have and we've developed over time is what we call our Cost Plus Drugs Marketplace. I liken it to the shopping mall of the 1980s because I'm an 80s kid. You'd go into the mall and you'd have all these different vendors available there. And that's exactly what Cost Plus Drugs Marketplace is. We've got some distributors through that shopping mall experience where any pharmacy that is in our network can buy any of the drugs that are on our Team Cuban card drug list at our actual acquisition costs. So we are never drowning the pharmacies on our costs, unlike a lot of the other solutions out there right now. That was really important to Mr. Cuban on down, and we've set those up in parallel to work hand in hand with one another. The other thing is, again, our baseline dispensing fee is $12 for a prescription. It goes up to $14 for cold chain drugs and or complex REMS drugs. And we have a few flu shots on our drug list, and those are a $25 administration fee. We also, through our network now, are building solutions in partnership with transparent pharmacy benefit managers to offer up our network and our pricing to self-funded employers. So your commercial benefits plan that you get from your employers has a pharmacy benefit manager attached to it. And what we're doing is we're leasing our pharmacy network and our pricing through those transparent pharmacy benefit managers. So employers with self-funded plans can actually benefit with our pricing integrated as a solution in local community pharmacies.
There's a lot more to it than just, prescriptions and dispensing. It seems like I heard a lot of things. Flu shots, how does that work? Is that just you're helping pharmacies get the flu shots?
We have a program with GSK, and we have a couple of their flu shots where they can acquire them at our cost, our actual acquisition cost, and we pay the pharmacy the $25 administration fee. So for giving the actual flu shot. So any cash paying customer can use their Team Cuban card to get their flu shot covered under our actual listed price on teamcubancard.com.
Very interesting. This has been very enlightening. Is there anything else you might want a pharmacist in the Perrysburg area to know? Any other ways that they can work with you?
Actually, pharmacies don't even need to be enrolled in our pharmacy network to take or participate in the Cost Plus Drugs marketplace. I will give you the link to that. You can share it with your listeners, Kim. Cost Plus Drug Marketplace, you don't need to pay any fees to sign up to use it. There's no minimums that you have to pay for to purchase drugs from the marketplace. It's available to any licensed facility that can stock drugs in the United States of America. A lot of hospital systems, renal centers, a lot of other places actually purchase from the Cost Plus Drugs marketplace as well. So I'll make sure you have a link to that if any licensed providers would like to learn more about Marketplace.
Thank you for providing that link. I'll put that in the show notes on perrysburgpodcast.com. Is there anything else you'd like to share?
I don't think so, but thank you for the opportunity. I think it's very, very important for civic leaders to start paying attention to their pharmacies in their local communities. 1 in 3 has closed their doors in the United States of America in the past several years. And a lot of these pharmacies going away in local communities is creating what we know as pharmacy deserts. There's fewer and fewer pharmacies available, and folks have to drive longer and longer to get to the closest touch point for healthcare. And we can't have that as a country because local community pharmacies are providing vital public health services close to home. I mean, pharmacy is the only profession in healthcare where you don't need an appointment to see a pharmacist. You can go into your local pharmacy, ask them questions, get your prescriptions filled, get your flu shots these days. And if we lose those in our local communities, the health will suffer for those local communities. So through our programs, we're hopeful, at least with Team Cuban Card and the Cost Plus Drugs Affiliate Pharmacy Network, that we're supporting those local community pharmacies because they in turn are serving all of us through better public health.
Well said. Yes, local pharmacists are important. And it's important that we still have pharmacies in Perrysburg for our community to go to. We are very, very fortunate. I think I counted more than 10 pharmacies in Perrysburg. So we're very fortunate. Hopefully that continues.
That's great.
I agree. Thank you. Erin, anything else before I let you go?
Just check us out at costplusdrugs.com and teamcubancard.com. We're happy to help you in any way that we can.
Perfect. Thank you very much for being here on the Perrysburg podcast. Take care, Erin.
Thank you.
Thanks again to Dr. Erin Albert for being my guest on episode 118 of the Perrysburg podcast. If you have prescriptions and you'd like to explore Cost Plus Drugs or the Team Cuban card, I have links to both in the show notes for this episode 118 of the Perrysburg podcast. Thanks again to all of the pharmacists, techs, and students who help all of us with our medication and vaccination needs, and happy National Pharmacy Week. Thank you for joining me for the fourth and final part of the medical series here on the Perrysburg podcast. You can find the show notes for episode 118 on perrysburgpodcast.com. In the show notes, you'll find the list of 10 retail pharmacies mentioned today, the prescription assistance programs and prescription savings cards that I mentioned, links to Cost Plus Drugs and the Team Cuban card, the Cost Plus Drugs Affiliate Pharmacy Network Google form that Erin mentioned, a link to Cost Plus Drugs Marketplace, a link to Dr. Erin Albert's LinkedIn profile, a link to my LinkedIn profile, and more. Lots and lots of links on perrysburgpodcast.com. I've even got a bonus link in the show notes today. It is trumprx.gov. That is in the show notes because in January of 2026, the website says that it will help you find your medication for the lowest price. As a pharmacist, I will be watching that website with great interest. Again, everything you need is on perrysburgpodcast.com. If you know someone who might like this episode, please share it with them. To be notified by email each time a new episode of the Perrysburg Podcast comes out, sign up for the newsletter on perrysburgpodcast.com. You can also subscribe to or follow the show on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks for listening today. Happy Pharmacy Week, and I'll talk to you next week.